Thank you for joining us today and welcome to Quality Payment Programs 2022 Year 6 QPP Overview of Foundations of Success. The information contained in this presentation is for general information purposes only. The information is provided by UK Healthcare's Kentucky Regional Extension Center, and while we endeavor to keep the information up to date and correct, we make no representations or warranties of any kind, express or implied, about the completeness, accuracy, reliability, suitability, or availability with respect to content. And just as a reminder, as we go through today's presentation, please put any questions you may have in the Q&A and we will answer them at the end of the webinar. We will send out a copy of the recording so that it'll be available to you in the next week or so. At the REC, we offer a variety of services to help meet both your inpatient and outpatient needs. This is just a sampling of the services we provide. And today's hosts will include myself, Alicia Anderson, and my colleague, Jessica Elliott. And today we look forward to speaking to you about the Quality Payment Program's path to value in healthcare, how 2022 programmatic changes could impact you, the benefits of performance optimization in the QPP, and demonstrate a little bit of quality improvement in action. And Jessica will start us out with the path to value in healthcare.
Thank you so much, Alicia, and welcome everyone. Thank you all for joining us this afternoon if you're in the eastern part of the state, or still this morning if you're in the western part of the state. So wanted to just talk with you a little bit about CMS's vision for obtaining value in healthcare. And that value, that definition, is really the sum of the quality of care that's being provided with those outcomes, with those positive outcomes that your patients have, divided by the overall cost of care for those services to be able to achieve those quality high outcomes and that advanced quality of care. And so that's really where value lies. And so CMS has devised this path to value. Traditionally, historically, healthcare has been a volume-based, service-based, fee-for-service industry. And so trying to transition to this value-based industry where it's about managing the quality and the outcomes, mitigated by, creating a platform for lower cost is really where, CMS is trying to move healthcare across the nation. And so CMS has created this platform for this avenue. And so it starts out with MIPS, really kind of dipping your toes, so to speak, into the water by having more of a pay for performance rather than pay for service. And then it stair steps up with some newly formed MVPs or MIPS value pathways that we'll talk a little bit more about, and then transitioning over into APMs or advanced alternative payment models. And there's a couple different levels of alternative payment models that get you fully into and transition you into that true value-based care where you have full capitation, where you have full risk and full potential earning rewards on the line for your organization. And that's where advanced APMs live. And so we're going to talk with you a little bit more about the two main tracks of the Quality Payment Program and what that looks like. Alicia?
So just to give a brief overview of the Quality Payment Program and the two tracks, by law, MACRA requires CMS to implement an incentive program, referred to as the Quality Payment Program, which provides two tracks of participation for clinicians, the MIPS track and the APM track. If you participate in the MIPS track, you can earn performance-based payment adjustments for the services that you provide to Medicare patients. In this track, clinicians are scored on 4 weighted categories: quality, cost, promoting interoperability, and improvement activities. And based on your score, you could receive a payment adjustment that is neutral, positive, or negative. For the MIPS track, starting in 2023, clinicians will have the opportunity to participate in MVPs or MIPS value pathways. MVPs are a subset of measures that are relevant to a specialty, medical condition, or episode of care, This option provides the opportunity for clinicians to focus on measures that are meaningful to their practice. And the second track available under the quality payment program is the APM track. An APM is a customized payment approach developed by CMS, and they provide the opportunity for clinicians to earn incentives who are providing both high quality and high value care. APMs can focus on specific clinical conditions, care episodes, or populations, and you can participate in a MIPS APM or an advanced APM. So you can participate in a quality program through an APP or an APM performance pathway, which is designed to reduce the reporting burden, create new scoring opportunities, and encourage participation in APMs. And just to note, it is anticipated that 2025 will be the final year of traditional MIPS. And starting in 2026, it is anticipated that MVPs and APPs will be the only reporting pathways available to clinicians. So Jessica's going to help us dig a little deeper into each of these tracks.
So as Alicia mentioned, we have the two primary tracks for the quality payment program. So let's first look at that MIPS track, or that merit-based incentive payment system track. So we have traditional MIPS, and traditional MIPS is what most of the clinicians here in the clinicians and practices really in the state of Kentucky have been attesting and submitting under over the last several years, since 2017, when this program really had that first performance year. And so with traditional MIPS, you have a wide variety of clinical quality measures. I believe for this year right now, there's over 200 clinical quality measures that you can choose from. You also have a whole host of improvement activities that you can pick and choose from as well too. There's different levels on which you can report, whether it's at the group level, at the individual clinician level. You can form virtual groups, but there's various means to participating in the traditional MIPS track. It is also, again, it's that first, dipping your toe into value-based care where you have a pay for performance outcome. So there's a positive or a negative adjustment based upon your performance. So if you score well, you get a higher payment. If you just meet threshold, you get a neutral payment. And then if you underperform, do not meet threshold, you get some type of negative adjustment that's applied to future CMS billing or CMS reimbursements. And so that's, how you can participate in that particular track. Now, this is beginning, the requirements for traditional MIPS are continuing to stair step and increase in the level of difficulty to score well and to not only meet threshold, but to also exceed in this program. So it's becoming increasingly more difficult to achieve those higher scores for that reimbursement. What CMS has also done is, because they've received feedback about traditional MIPS, that there's too much variety of measures and that it needs to be more focused and it needs to be more representative of all different clinician types. Because some of the feedback that eligible clinicians and practices have given is that, it's not very representative of specialty practices. And so MIPS value pathways has been created. This is another way that you can participate in the MIPS program through the quality payment program. And so MIPS value pathways are going to be more focused on a particular type of patient population, a type of or episode of care, a type of illness. So it could be aligned with diabetes, it could be aligned with emergency medicine, it could be aligned with chronic disease management. And so there right now are currently seven approved MIPS value pathways that are going to go into effect in 2023. Right now, for 2023 up until 2026, it's optional to participate in these MIPS value pathways. You're going to have more of a limited, focused scope of measures that you can choose from as far as quality measures as well as improvement activities. So it helps limit the scope a little bit. And so you don't have quite as much of the smorgasbord to choose from. And so it's ultimately, again, in a way for practices and clinicians to start really making that shift in mindset of looking at a subset of their patient population to be able to drive change and improvement. There's going to be some pluses and minuses with this particular MIPS value pathway, and we'll talk about that here in a couple slides. Now, alternative payment models. So Alicia also talked a little bit about APMs. And so APMs are contractual agreement, right? So, and there's various levels of engagement that you can have with an APM. And so CMS has different ways in which you can interact with the quality payment program based on your connection with that APM. So if you're a part of a MIPS APM or a part of an ACO, you can participate in MIPS through the alternative payment model. You can through the APP pathway, so the APM performance pathway. And again, you're going to be able to have those incentives for, quality coordinated care. And as Alicia mentioned, it does focus on, the APM model that you're entered into is going to focus on, similar to a MIPS value pathway, a type of condition, an episode of care, or a population of patients. And, so think about, those CPC plus models, Medicare shared savings models are a very, very common one that we see here in the state of Kentucky. Those are going to be your MIPS APMs. And then when you get to that final advanced alternative payment model, this is a even smaller subset of APMs. So these are CMS deemed advanced alternative payment models that have full capitation. So whatever cost overruns that you would have for your particular patient population, your episodes of care, however your model is set up, you are on the hook for those. And so it's being able to manage and balance both the upside and downside risk related to, balancing patient outcomes and that cost of care that's being delivered. One of the big upsides with participating in that advanced alternative payment model is really that guaranteed 5% positive payment adjustment or positive payment bonus that you get if you're considered a qualifying participant in an APM. Now, Alicia's going to talk to you about the performance categories that really actually do apply to all of the different tracks and pathways within the quality payment program.
So whether you are on the MIPS track or on the APM track, all 4 of the categories will apply to you. They just might look and feel a little differently depending on which track you're participating in. So for the quality category, all programs will require some type of submission. If you're on the MIPS track, you will need to submit your quality measures directly to CMS during attestation. And if you participate in an APM, you would submit your quality data through your APM. And when we look at cost for the MIPS track, you do not need to submit anything for cost, but you will be scored based on your Part B claims. And if you're participating in an APM or a MIPS APM, you would not be scored on cost because the cost is inherently part of the contractual agreement you enter into as part of an alternative payment model. And from promoting interoperability, both MIPS and APM participants will need to submit for PI. However, there are special status reweights available for this category for both tracks. So if you qualify for a special status, you may not need to submit to PI, regardless of the track you're on. And for improvement activities, whether or not you participate in MIPS or if you're part of an APM, you will be scored on improvement activities. For both tracks, you can earn up to 40 points. But if you're part of an APM, depending on the type of APM you are in, you could automatically receive full or partial credit for this category. And now Jessica will tell us a little bit more about how the REC can help you.
Alrighty, so we understand that, navigating the quality payment program is probably not your full-time job at your practice. And so one of the things that we do whenever we partner with you at the Regional Extension Center, we help you check eligibility. We help you stay on top of that so that you can understand, which track you're going to be reporting in, understanding the nuances between reporting through, MIPS or now the newly formed MIPS value pathways in 2023, as well as what do you do whenever you have been participating in MIPS, but you also see that several of your clinicians in your tax ID are now tied to an APM. What does that mean? What does that look like? So we help you navigate all of those parts and pieces of eligibility to understand how to maximize your positive, positive payment adjustments and reimbursements for the program. Additionally, something that we also do whenever you're a client with us is, we digest, every 6 months, we digest over, 2,000 pages of legislative rule and proposed rules from CMS related to the quality payment program so that you all don't have to read it. We summarize it and we present webinars on it. We have webinars that are open to the public, but we also do have very client-specific webinars that we also give a first sneak peek at and really break down the final rule for our clients in particular. We also, excuse me, we also do prepare impact analysis for our clients so that they have, a detailed document to take to their senior leadership to help with strategic planning, to look at what is forecasted in the future and how they can help rise and meet that challenge that's ahead. And also, we also help keep up to date on some of the special impacts that come along the way, whether it's COVID-19 and some of those EUCs and how to navigate that, those extreme and uncontrollable circumstances, that hardships and those exceptions that come our way, or whenever there's, those surprise CQM adjustments for measure suppression like that we've seen recently around BMI for 2021. We work with our clients on how to navigate those. And then additionally with performance feedback, we work with you on interpreting and understanding your feedback reports that you get after your performance period. We make sure that, that everything has been calculated and adjusted correctly, and we help you through that targeted review process if there have been any issues that have been identified. So we really provide that at the elbow support to really help you navigate and help you understand whatever pathway that you're choosing to participate in. And then now we're actually going to transition over to discussing some programmatic impacts.
Since most practices currently report through the MIPS track, we're going to dig a little deeper into MIPS 2022 weighting and thresholds. So for traditional MIPS, the category weights for 2022 have quality and cost aligned at 30%. Promoting interoperability is weighted at 25%, and improvement activities are weighted at 15%. There were also some changes to the performance thresholds for 2022. Performance thresholds are determined by the mean of previous years. So as scores increase, we'll see the thresholds increase. So for 2022, if you score 0 to 75 points, you could receive a negative payment adjustment up to 9%. If you score 75 points, you would receive a neutral payment adjustment. And if you score between 76 and 88 points, you could receive a positive payment adjustment through the budget neutral portion of the program. And if you scored above 89 points, you would be considered an exceptional performer. So you would receive a positive payment adjustment under the budget neutral part of the program. Plus you could be eligible to receive an exceptional performer bonus, which is part of the $500 million pot CMS has set aside. And this year will be the last year you can receive an exceptional performer bonus. So it's important to note that as scores continue to increase, we will see the thresholds continue to increase as well. And since this is a budget neutral program, it is anticipated that with higher thresholds, there will be more losers to fund the winners. So even though it will become more challenging to meet the threshold for a positive payment adjustment, we could see higher payment adjustments for those who do meet it. And Jessica will help tell us a little more about the future of MVPs.
So as I hinted to and alluded to a little bit earlier, I wanted to give a little bit more detail and a little bit more context to MVPs and some of the things that I think are important considerations that we need to look to as far as practices, whether you're an individual clinician that's attesting or whether you're going to be a group, whether you're a single group or a multi-specialty group, and how to kind of navigate that. So again, the first year of reporting for MVPs is not going to start until 2023. And you're going to be able to report at a couple different levels, right? So you're going to be able to report an MVP as an individual eligible clinician, or you're going to be able to report at a group level, or you're going to be able to report as an APM entity or even as a subgroup. And by a subgroup, CMS has created this ability or this pathway for a multi-specialty group to split off into its own specific clinician group. So say if you are a practice that might have, or you're an organization that might have multiple specialists providing providing care under the same tax ID. So you might have a group of clinicians who are orthopedists, as well as anesthesiologists, as well as surgeons. And you might also have a family practice provider as a part of your clinic. And so each of those separate individual clinicians, CMS ultimately wants to make sure that there are clinical quality measures and cost measures and improvement activities that align with each of those different clinician types so that they're represented under the quality payment program. Because traditionally, a lot of the measures that have been used so far are more representative of primary care. And so some of the specialists feel like they're underrepresented in the data that's being sent out at a larger tax ID or group level. And so by breaking off into these subgroups, it's going to be able to, CMS feels that they're going to be able to have more representative data across all of the different clinician types. And so with that thinking, there's also going to be some challenges that come with that, right? So you're going to have to be able to look at how are you going to be able to report this data? Does your EHR have capabilities to be able to generate files and to be able to look at data at a subgroup level, to be able to just look at the clinician type rather than your entire tax ID? And so there's some differences with that as well. Also, the measures that you're able to report on. So with MVPs, you're required to only submit 4 measures. So that's a little bit different than traditional MIPS for clinical quality measures. And you can submit either through your EHR or through registry measures. And so looking at how you want to participate in the program. If your EHR doesn't support those type of specialty measures through your MIPS value pathways, you would have to look at moving to a registry to be able to submit that data for that pathway. So there's a lot of different considerations to start thinking about as far as how you would begin to navigate participating in an MVP pathway if you are looking at it at that group level. Now, CMS is going to allow groups to be a multi-specialty, to submit as a multi-specialty through 2025. But whenever 2026 hits, you will then be expected to fracture off and to break into that individual subgroup reporting level, to where if you do have that multi-specialty practice, you would have to have a separate MVP for your anesthesiologist. You'd have to do a separate MVP where you're monitoring separate measures for your orthopedists, and that's going to be separate from your other clinicians as well, just so that you have representative data across the board. So that can get a little bit complicated. The more different types of clinicians that you have, that's going to make more nuanced reporting for you. So I can definitely see that that's going to present some challenges coming into the future. Ultimately, right now, the way the legislation is being written is that in 2026, you're going to have 2 different options of how you're going to participate in the quality payment program. You're either going to be part of the MVP track. Traditional MIPS is going away. How we have done it in the past, where you have the entire smorgasbord to pick and choose what you want to measure, is going to go away, and you're going to either be in an MVP or you're going to be in an APM, and you're going to be participating in some type of an advanced alternative payment model through that APM performance pathway. So again, lots of things to consider with the world of MVPs and what that's going to look like and feel like over the next few years for sure. Alicia, do you want to talk to them about sequestration and what that looks like?
So sequestration has returned for 2022. It'll be a phased in approach. So starting in March, you will begin to see these adjustments on your EOBs. By July 1st, it will be held at the full 2%. And this is on top of any payment adjustments that may be applied for MIPS. And just to remember, there is a 2-year period between your performance year and your payment year. So the MIPS payment adjustments you will see in 2022 will be from your MIPS performance year of 2020. And Jessica can tell us more about further programmatic impacts for 2022.
Oh, excuse me. I hope y'all, I think I might have lost audio for a second there. So thank you, Alicia. What I wanted to do is, again, sequestration is going to be something that is a very important impact for our practices. Having that 2% taken off right off the top is something that we got used to having added back in. And so that is definitely going to be something to really, really think about. Something else to consider, though, is that removal of the exceptional performer bonus that Alicia mentioned. So if you think back to that pyramid a couple slides ago, you have to have for 2022 at least 89 points to be able to be in that $500 million incentive pool that guarantees you some type of positive payment adjustment. Because this is a budget neutral program where the losers do fund the winners, and typically historically, the stakes haven't been as high, so we've had a lot of winners and not a whole lot of losers. And we've also had a lot of flexibility the last couple of years due to COVID. So folks have been able to take hardship exceptions and things like that have been able to create that budget neutrality. So we haven't had a lot of penalties to help fund those positive payouts. So that's going to be interesting to see what that's going to do as far as future years having that incentive pool go away, what that's going to do to impact payouts. Next, and I kind of touched on this, is just what that's going to look like for MVPs. The challenges that we're going to have around reporting, making sure that our EHRs have the measures that they need to have to be able to report for whatever MVPs that we need to report on. If you're reporting on multiple MVPs, that's going to be a challenge to juggle 50, 60 clinical quality measures that you're monitoring, as opposed to the 9 or 10 measures you were historically reporting just through traditional MIPS. And then also looking at, that future landscape where CMS wants to transition us, from MIPS all the way up through advanced alternative payment models, making sure that whenever you do join an alternative payment model, you're doing so with the knowledge base that you need to succeed, simply because, there is that risk that if you are, if you have overruns on your costs, that you are liable for them. And, so making sure that the approach to addressing, all aspects of that patient's care or that episode of care is something that you and your partners in that APM are prepared and ready to address. It's definitely something that has to be at the forefront of our minds whenever we're transitioning to an APM. And then also something, again, too, to consider is just really that the continued increases in MIPS, the stair stepping of the difficulty to score well in this program. We've seen from 21 to 22 that the threshold to avoid penalty has increased 15 points, going from 60 to 75 points for 2022. So that is, again, going to be a challenge, I think, for a lot of practices, especially a lot of practices who've maybe taken the extreme and uncontrollable circumstances due to COVID for the last year or two, and they've not really been in the quality game for a while. Trying to get back into these higher thresholds for quality could potentially be a challenge for them. And again, CMS does, and there's a potential for them to continue to increase that threshold. The way the legislation is built, they will base the threshold to avoid penalty on the mean or median of previous performance years. And again, because it has been easier to succeed in the past with a lot of bonus points and a lot of flexibilities, a lot of times the mean and median score is going to be up in the 70s and 80s. So that's definitely something to consider, that it might not stay this low at 75, but it could potentially get higher to avoid penalty. So again, there's lots of different impacts. And then let's talk about and kind of transition over to how do you take these impacts, these things that I worry about for my practices, and what can we do to be able to help mitigate them, to help lessen some of that impact. So when you think about the loss of that exceptional performer bonus, hardwiring quality improvement, getting that foundation of process improvement and quality improvement embedded in your practice, understanding tools, understanding your data, having those conversations, digging into your numerator and denominator performance about why is our performance looking like this? It's really important to start having these conversations now, having them early in the year, but most importantly, having these conversations now so that you can get a good handle on your quality improvement, so that you can make these changes and hardwire that within your organization. Also, whenever you work with us, we help you really dig into what are these flexibilities, what are these opportunities that you have to be able to make the most out of your score and out of your points. So we use gap analyses. We do a lot of work to try to figure out what's going to be the most advantageous pathway for you to get the most points, to have the highest score, to have the most earning potential with these programs. So kind of addressing that issue with MVPs and APMs, we would like to work with you, and we work with our clients to really talk about different strategies. How can you start to dip your toe in the water to test MVP participation? What would that look like for you? And how can, we help you start to prime that pump to figure out, how do you want to start looking at those pathways? We also do a lot of education around APMs and just overall readiness and requirements for APMs, but also once you are in an APM, we can help support the data requirements, the quality monitoring, and different attestation strategies for APMs as well. And then again, how do you address the increasing penalty avoidance thresholds that we see with the NIPS track of the quality payment program? We really focus with our clients on, streamlining their participation across all the performance categories. So not just quality, but really maximizing what you're doing with your promoting interoperability, finding those opportunities with your improvement activities to really have that synergistic effect as well. And then making sure that, we are providing education and tools and resources to help you hardwire those, quality improvement principles so that you can have that lasting and really truly sustainable change within your practice. Now, Alicia, would you like to talk with them a little bit about some of the benefits of performance optimization?
So MOOCs was designed to tie payments to quality and cost-efficient care, drive improvement in care processes and health outcomes, increase the use of healthcare information, and reduce the cost of care. So by optimizing your performance in the quality payment program, you are also impacting your quality measure performance, your patient experience, care coordination, and how you exchange healthcare information, All of this leads to improved clinical practices and care delivery, ultimately leading to improved health outcomes. So when eligible clinicians and practices optimize their quality performance, they are not just increasing their MIPS performance scores, they are improving the care they provide to their patients. And by maximizing promoting interoperability, you are also improving how you communicate with other organizations as well as your patients, which not only helps improve your patient's experience, it can help reduce the workload for clinicians and staff. And when you choose an improvement activity that is meaningful to your practice and your patient population, it improves the care your patients receive. This is all why it's so important to choose measures and activities that are meaningful to your practice and patients. And our advisors are able to help you align your goals with the quality payment program. So not only do you see an improvement in your scoring, but you make a clinical impact along the way. So let's look at how your performance in the quality payment program can have a financial impact. Optimizing your performance can help eliminate or reduce the negative financial impacts that eligible clinicians and practices face. And you can actually improve the possibility of receiving positive payment adjustments. With the return of sequestration at 2%, receiving a positive payment adjustment will help offset that 2% that's going to come right off the top. And again, the exceptional performer bonus is going away after this year. So starting in 2023, payment adjustments will only come from the budget neutral part of the program. And when we look beyond the quality payment program, performance optimization can help you receive higher performance incentives for other payer and quality programs. Many of the measures that you work on for the QPP will align with other incentive programs as well, allowing you to benefit from those incentives too. And this slide illustrates that all practices, regardless of the size, can be substantially impacted either positively or negatively by payment adjustments. And those negative impacts can become even more substantial with the reinstatement of sequestration. And since the quality payment program is a budget neutral program and the program is getting harder, there will be more incentive dollars on the table, giving you more opportunity to reach those higher incentives. It's also important to consider your Part B billing. So the higher your Part B billing is, the higher the loss or incentive can become. And these examples include a small practice to a larger practice, but if you have multiple tax IDs, they'll start to accumulate. So maximizing your performance will give you the best opportunity to reach a positive payment adjustment. And so beyond clinical and financial impacts, practices also should consider reputational impacts. CMS has pushed for a transparency in price, performance, and data, and has established a requirement of public reporting through Physician Compare. Through Physician Compare, CMS publishes each eligible clinician's annual performance results, and information that is available to the public includes each eligible clinician's final MIPS score, as well as their category performance scores, and those scores can be identified at both the provider and the group level. For those on an APM track, Physician Compare will show the names of eligible clinicians in an advanced APM, the name of the APM, as well as their performance. And Physician Compare also publishes patient experience performance data. With the use of public reporting sites like Physician Compare, a practice's reputation and their finances can both be impacted. It has been found that 65% of consumers are aware of online physician rating sites. 36% of consumers had used a rating site at least once, and a 1-star difference on a 5-star scale can make a 5 to 9% difference in service provider revenues. So this shows us that reputational impacts can also result in financial impacts. And Jessica will tell us a little more about how the REC can help with these impacts.
Thanks, Alicia. So there are a lot of different forces that are at play here, and we understand that you are, trying to deliver care to your patients. You're helping to support your staff. You are, juggling a lot of different, you're spinning a lot of plates in the air at the same time. And so our goal is really to help you identify your priorities, set targets and aims and objectives that matter most to you. find that low-hanging fruit amongst the multiple different programs that you're participating in so that you can have some synergistic effects, right? So if you're already participating in PCMH, how can you leverage your PCMH activities to help support the work that you're doing in MIPS or in the quality payment program? How can you get, how can you work on, your private payer reimbursement, those contracts that you have with Anthem or Humana or WellCare and those different incentive programs, or the HEDIS reporting, and how can you align that with the quality payment program? So there's a lot of different work that we try to do to help you identify your priorities so that you can move forward, and to be able to truly, work smarter and not harder. So now let's shift gears a little bit and talk a little bit about that quality improvement in action, and just how that relates to, just kind of focusing in on the quality improvement category and just focusing in on MIPS, right? Because that's the most important, that's the primary track that most people are reporting on right now here in the state of Kentucky. And the quality category for the MIPS track is now at 30%. It was at 40% in 21. It has been reduced to 30% because cost is now equally weighted at 30%. So some of the biggest impacts that I wanted to just make sure that everybody is aware of for 2022. CMS is removing bonus opportunities, and this is a big deal. So anytime you submit your clinical quality measures electronically, meaning that you utilize an EHR to submit your data, you have always been able to receive one additional bonus point for each measure that you've submitted electronically. So that's 6 points that would be added onto your score. CMS is removing that for 2022. Also, you receive an extra outcome or high priority bonus point. You actually can receive 1 to 2 points for every extra outcome or high priority. You're only required to submit one, and CMS has always incentivized practices to submit more than one. And so that actually is going away. So I was working with a practice recently, and when I added up their attestation for 21 and looked at how many end-to-end points, excuse me, and how many extra outcome and high priority measures, those bonus points that they were going to be losing in 22, that was about 10 points. So that's a huge impact on that practice to lose 10 points in quality based on those bonuses. Now, I will say they are retaining the 6-point small practice bonus. So if you have less than 15 clinicians tied to your tax ID, you would still be considered eligible for 6 bonus points for quality. They've also added some population health-based measures. We now have 3 population health measures that could be a potential added scoring to your total quality score. 2 of those are for larger practices that are over 16 eligible clinicians. There is 1 measure, though, that can be applicable to individual eligible clinicians. All of those population health measures are based purely on case minimums for meeting that particular measure requirement. Something else to think about. So whenever you submit a quality measure, you are scored against benchmarks. These are historical benchmarks, and you are awarded points of where you fall in those decile categories. So if you've ever scored for a measure and you've fallen below the 3rd decile, you would receive 3 points for that measure. And you would historically always receive 3 points for that measure, even if you were below the 3rd decile. CMS is going to be removing that 3-point floor in 2023 for larger practices. Small practices, you'll still have that flexibility. But for larger practices, you're going to receive anywhere from no points, so 0 points, all the way up to 10 points now for your clinical quality measures starting in 2023. So that's another impact, that you won't have that buffer anymore of 3 points. Also, something else that has been a major impact that we've seen, again, is that measure suppression. CMS has suppressed several measures, removed benchmarks from scoring for 2021, making it a little bit more difficult to find some more commonly reported measures, around BMI, controlling or blood pressure screening, things like that that have lost their benchmarks for. And so pneumonia vaccination was one of them as well. And so thinking about that through that lens, making sure that you have multiple measures that you are monitoring outside of those 6 measures is incredibly important for your practices moving forward. So how do we help you with that? Well, first of all, when you're trying to move the needle on quality, you have to know where you're starting from in order to determine where you want to go. So one of our first levels that we do is we want to dive into the data with you. We want to look at your reports. We want to kind of see if they pass the sniff test, looking at your numerators and denominators, and then taking that a step further and going and looking at, what are the patient lists that make up your numerators and denominators, digging into the actual documentation, the workflows, the measure specification sheets, and working on getting those all aligned. Then, we take your data and we do a gap analysis. We do a gap analysis for quality, for promoting interoperability, and for your improvement activities to give you an estimate on where you're at and help you identify your goals and where you want to be. And we develop an action plan with you to see, what you want to work on, what's going to be a priority for you to help improve, and how do you want to get there? Because ultimately, at the end of the day, our goal for you is not only to just help you, achieve that quality improvement score, to help you achieve that overall, that bonus and that incentive, but it's also truly to help, raise and elevate the standard of care and help elevate the delivery of care to Kentuckians across the state, because, it's our family, it's our friends, it's all of our communities that are being impacted, by these measures, by this program. And so I think it's just an opportunity for us to work together on this. Now, for controlling high blood pressure, this is just an example of something that we would do to kind of pick apart the process of looking at a measure. So first of all, is this a meaningful measure for your practice? If this is something that you have no stake in for controlling high blood pressure, this might not be meaningful for you to use. So that's kind of a surface level that we kind of start with. Does this fit the scope of your practice? Is this the best measure for you to choose? Then, what are your goals for this measure? Do you want to improve this measure? What decile do you want to get to? Where are you currently at now? And then we dig into that and we start looking at, what are your workflows? What is your documentation? Are there any issues with reporting from a workflow side to an actual EHR side? Does a flip need to be switched, or is somebody putting the data in, are they scanning in a document, but they're not actually putting in the lab values in a discrete field, something like that. So, trying to identify where the processes are breaking down. And we use PDSA, Plan, Do, Study, Act, as a methodology. It's quick, it's easy, it's simple. We use the IHI model for improvement to help drive change, to ask the questions that need to be asked, to set goals, to set realistic goals and objectives for you and for your practice to really help move the needle. And, here's just a very stylized look at like a measure specification sheet. We'll pull a measure spec, we'll sit down with you, we'll talk with you about what goes into that numerator, what goes into that denominator. We'll have you pull your workflows for your EHR. We can sit with you and help you kind of walk through and align it, look at your numerators, look at your denominators, follow a patient and see how they fall into those reports, what triggers and what's not triggering for them, to help you identify those areas when we're digging down deep into some of your data. Here's again just an example of a workflow where you start out and you go through line by line to truly figure out where that patient is falling into that particular measure. And so we do a similar process for promoting interoperability. We look at your numerators and denominators and validate them. We work on some of the connection resources with our fantastic partners at KHI to make sure that you all know the services that are available through their systems and their abilities, and make sure that you have those participation agreements to be able to meet your measures and those objectives. And we also provide audit support for all of our categories. Same thing with cost. We look at historical feedback that's been provided by CMS to help do an analysis on your previous performance to help forecast what your potential cost could be in the future and opportunities for improvement in those particular areas. And then same thing with improvement activities. We work with you on the different activities that are available and talk with you about what are some common practices in your own workflows that we can use so that you're not having to reinvent the wheel every time you attest for improvement activities. We don't want that category to ever feel like it's a burden for you all. It should be supporting the work that you're already doing within your practice. And this is a busy slide with a lot of words on it, but just wanted to kind of recap some of the work that we do whenever you do partner with us here at the Regional Extension Center. Not only are we there to help check your eligibility and provide those legislative updates, but we're here to go into deep dives on your data. We're here to help you figure out issues with reporting, to help you work with your vendors. We're here at that high level for those strategic plans and for helping to guide you and to get that, cross-program kind of pollination, but also to get down into the weeds with you when you need it. So again, please don't ever hesitate to reach out to us with questions. We have some upcoming webinars. Our next webinar is open to the public again. It's on eligibility for year 6. So we're going to talk to you a little bit about how to get into the system, how to check your eligibility, how to understand what that's going to look and feel like for 2022. The next webinars that we do have, those are client-only webinars that are focused on those specific quality or those specific categories for the program. And so you do have to be a client with us to have access to those, but we will have other public webinars in the future. In the meantime, here is our contact information. And if you'd like to go ahead and if you have any questions, please go ahead and put those in the Q&A box at the bottom of your screen. And I will check that here in just a second to see if we have anything that has popped up. Let's see. There's a question on 2022. Is this the last year to report traditional MIPS and then it goes to MVP? No, you'll still be able to report traditional MIPS concurrently with MVP for the next several years. 2026 right now is the way the legislation is written that traditional MIPS will sunset and MIPS value pathways will be the primary pathway to participate under MIPS. So you'll be able to submit both side by side, MVPs and traditional MIPS in 23, 24, and 25. See, I have another question. Do you know when the quality measures will be released for 2022? And actually, I do have an update. They actually just released them this week. I'm not sure if it happened yesterday or day before, but if you go to qpp.cms.gov and you go into the Explore measures and look for program year 2022, the measure specifications for year 2022 are up and available. So you can look through those and see what's available. When I looked this morning, there were 48 EHR measures available and 200 total measures, including registry QCDR measures available for the performance year. Let's see if we have any other questions. We'll give it just another moment. But if you are interested in working with us, please feel free to contact us. And if you have any other questions regarding the quality payment program, please feel free to reach out to us, call us, go to our website, KentuckyREC.com, or to email us at kyc@uky.edu. We are always more than happy to help answer your questions. All right, thank you all so much. I don't see anything else in our chat or our Q&A, so just do one last check. All right. And thank you all so much. You all have a wonderful day.